Welcome back to Our Issues Milwaukee. I'm your host, Andrea Williams. The Affordable Care Act's 2018 enrollment period will soon begin on November 1st and go through December 15th. Here to bring you up to date with everything you need to know is Caroline Gomez-Tom. She is a Navigator Manager for Covering Wisconsin and Project Manager for Milwaukee Enrollment Network. We're also being joined by Frank Robinson, who is a Program Manager for the Community Healthcare Access Program for the City of Milwaukee Health Department. Good morning.
Good morning.
Thank you both for being here. And with the ACA, or Obamacare, as many people refer to it as, there have been quite a few changes in the last few weeks. And by the time this airs, there are probably going to be a few more changes. But what we'll try to do is really take a look at this 2018 enrollment period, again, which starts on November 1st, just a couple of days away. And really the goal is for people to really understand what it is they need to do to be successful at getting enrolled. So for starters, this enrollment period is much shorter than it has been in the past. Somebody explain to us why.
Sure. So this year it's November 1st through December 15th, which is significantly shorter from the previous year, which was from November to the end of January. And this actually was supposed to be changed for the next open enrollment period, but with the change in administration, they decided to shorten it. It was under the market stabilization rule that they decided to shorten it, thinking that it would essentially provide some support for the qualified health plans if they had a shorter window to get everyone enrolled in coverage. But what it really is doing for us on the ground is really giving us a significantly shorter time, unexpectedly, to help enroll as many people and renew people's coverage in a very small window.
Yeah, and it's unfortunate because it is ultimately the people who need to be covered that really get caught in the crossfire, so to speak. So many people, of course, will remember just a few weeks back, President Trump signed an executive order that slashed about $7 billion in subsidies to insurance companies. So if you could kind of chime in and explain who's going to be affected by that, and really ultimately how will people be able to deal with that change?
Yeah, well, the state of Wisconsin was kind of planning on the subsidies not being continued.
Okay.
So what the insurance commissioner of the state of Wisconsin indicated to the health insurance carriers is to put together rates that would not include, say, the cost share assistance. So those rates were turned in, and they were just released 2 weeks ago on Thursday. So when the president made that statement, with Wisconsin, and that's not inclusive with the other states, essentially had their rates set to make their increases so that the bite of not receiving the cost share dollars wouldn't be as much. So the folks that are going to be affected the most are the folks that are over 400% of the federal poverty limit. So they'll be purchasing plans that could be on the bronze, like the bronze plans, and also the gold package plans. What the insurance commissioner also did is they're going to raise the prices more so in the silver plans, and the silver plans are where most of the folks get their insurance coverage, where they get the cost share assistance and where they were getting the premium assistance. So essentially what it does, by raising it there, the amount of the premium assistance will be raised too at that point. So
wow.
It won't be as much of an impact on the folks that are dependent on, say, the cost share dollars, because the cost share dollars still have to be covered by the insurance companies for anybody that's that qualifies for it, that's under the 250% of the federal poverty limit.
Wow, it's all so much to digest. So, and I talk about subjects every single day, but I do find this subject very difficult sometimes to understand. So that's exactly why I have you here today, to really kind of break it down for people to better understand what it is they need to do. And then when you start throwing in all these changes, it just becomes very confusing. So thank you both for being here. With the current White House efforts to pull back on ACA outreach, many people like yourselves are bracing for a pretty tough season ahead. So you lost 42% of federal support to help educate people, and then you had 90% of your advertising dollars that were taken away as well. And politically, it almost looks like that's done purposely, because we know that the Republican Party really does not care for Obamacare in the way that it stands as we speak.
Sure, and it was definitely a hard hit. So Covering Wisconsin, our Navigator program covered 23 counties, and we did have to cut back to 12 counties that we can serve, which includes Milwaukee County. And also, we had to cut 4 of our subcontracts out of the 6 that we have to reach all those consumers. So it really was significant and made us move our strategy. But one thing with the Milwaukee Enrollment Network and all of our partners here in the city, we're really able to put all hands on deck and make sure that we can reach as many people as possible. And what we've been able to do is seek additional support from some of the qualified health plans and other partners to support advertising in the city so that we can maintain at least a local touch and get the message out about dialing 211 to reach local enrollment assisters in order to promote the enrollment events that we're going to have pretty much every other day during open enrollment, and really get the word out about how people can access financial assistance to help lower their monthly premiums and get access to coverage that will cover their healthcare needs. Okay,
and you did mention that people can simply dial 211, and you also have this new high-tech thing people can do as well. Text their zip code for free enrollment assistance, and that code is?
So if people text their zip code to 898-211, they can get that same assistance from the local 211 in their area. And what is really great about our partnership with Impact 211 here in southeastern Wisconsin is they're also able to book appointments for enrollment assistance.
Okay. All right, that's good stuff. And if we could talk a little bit about the Milwaukee Community Healthcare Access Program and how it is designed to assist people in the community.
Well, our program specifically is set up through the City of Milwaukee for the Milwaukee Health Department. And what we do is we help to sign up folks for all of the public benefits. That would be Badger Care Plus, Food Share, Child Care, and also the Marketplace. So we do have certified application counselors that are part of our particular program too. So essentially what we do is we do this, and it's a year-long process, you know, so we're open Monday through Friday, and we are actually at 3 different health department sites. So essentially with those particular programs, what we do is we will assess the needs of the client that actually comes into us, because we feel it's very important to understand that the person across the table from you is actually a human being. And a lot of times when they come in for services and they're just seeking a simple service, a lot of times at that particular point, there's more services that they're in need of. So what we do with our particular staff is we don't ask them, what are they applying for today? We actually ask them, how can we help you today? And based on the feedback that we get from the client, a lot of times we're able to make referrals off to other social programs that they could be in need of, like housing. In some cases, we can help someone get expedited food share benefits. So if they're hungry, they can eat today and not have to wait for weeks to try to wait for like an approval. So it's those things that we want to do proactively that helps that client at that particular moment in time.
Makes a lot of sense. And of course there are several health centers that people can turn to get information as well. You have the Southside Health Center on South 23rd Street, Northwest Health Center on West Mill Road, and then the Keenan Health Center on North 36th Street. So can they just visit those centers and kind of get that same type of assistance?
Yeah, that's the great thing about our services is that we don't do appointments. We actually do like walk-ins.
Walk-ins, yeah.
So we don't want to have anybody that has to wait because someone has an appointment. So we're pretty much able to see them rather quickly, and that process has worked very well for us.
Okay, and I'll remind everybody they can always call 211 to get those addresses and find out exactly where they need to go. Covering Wisconsin, you are working with that entity, and for many years they've spent time reaching out to health providers and school districts and community organizations to actually develop strategies that can help best fit individuals and their families access health coverage. So there's quite a few that fall under the umbrella, and people can really utilize those organizations as well in trying to enroll.
Yeah, so it's twofold. Covering Wisconsin, we are the Navigator awardee, so we are able to help people with understanding the options, health insurance literacy, getting enrolled, and then we work closely with our partners across the state to make sure that we have a standardized strategized message about getting the word out about healthcare. And then with the Milwaukee Enrollment Network locally, we have 100+ organizations working around issues impacting healthcare coverage and the Affordable Care Act to make sure that we are also getting as many people enrolled locally as we can. And one thing that's also important to know is that along with the Affordable Care Act, we also work so closely with the state's Medicaid program, Badger Care Plus, and open enrollment is an opportunity to not only get people access to the marketplace, but low-income individuals and families can sign up for Badger Care all year long, but it's usually these messages around Obamacare and the Affordable Care Act that get people out, and we can help people sign up for Medicaid too.
That's good to know. And we did mention early on that things continue to change, sometimes day to day, week to week, but our goal is to try to keep people up to date. But as of now, you've got Molina Healthcare that is leaving the marketplace for 2018. That affects about 65% of the marketplace. So people need to have that in mind and do what?
Yeah, so members of Molina Healthcare should have received letters already saying that Molina was no longer going to be available for 2018 as an option in the health insurance marketplace. And what we're recommending those folks do is do what anyone should do at this current venture that needs health insurance or needs to renew, and reach out to one of our enrollment assister locations by calling 211, by texting 898-211, and we can help them look at the options that they have. We still have a lot of options in our health insurance marketplace. Even with Molina leaving the marketplace, we have Common Ground Healthcare, we have Children's Community Health Plan, and we have Network Health Plan. So there are still places people can go. It's really just making sure it's the right fit that cover their doctors, their medications, and other services that they need met.
Okay, guys, as we wrap up, I want you to quickly think, what is the #1 question that most people have when it comes to enrollment?
I would say #1 is, do we still have to apply? We've had some crazy things that have actually happened, like some folks that indicated that Obamacare is gone because the president is no longer in office. So we get like a lot of things that are out there where there's rumors and things like that, but because we don't actually have like an advertising budget because of the 90% cut, we're not able to use those monies to do some fact checking and some things that need to be done.
Wow, well, thank you, and that's why you're there. So, and that's definitely why you're here today. So I thank you both for your time. It's been a pleasure. Caroline Gomez-Tom is a navigator manager for Covering Wisconsin and project manager for the Milwaukee Enrollment Network. And Frank Robinson works for the Community Healthcare Access Program for the City of Milwaukee Health Department. For more information on anything that we've discussed today, you can visit coveringwi.org or call 211. And of course, for free enrollment assistance, you can text your zip code to 898-211. That is going to do it for today's show. I'm your host, Andrea Williams. As always, thank you for watching, and I do hope you join us again next week as we take another look at Our Issues Milwaukee. Have a great day.